Within the last hour, the FDA committee voted to recommend the second COVID-19 vaccine for emergency use authorization. Assuming it gets approved, distribution of the Moderna vaccine could start next week. Meanwhile, the Pfizer vaccine is rolling out in Maryland. Frontline healthcare workers already getting that first dose. WMAR2 News' Abby Isaac spoke to a Johns Hopkins critical care doctor who got the vaccine yesterday.
The critical care doctor says aside from a little soreness at the injection site, he hasn't had any side effects more than 24 hours after getting his first dose of the COVID-19 vaccine. And he said he's very thankful to be one of the first in Maryland to get it.
It is a palpable fear we've all lived with over the last 8 months.
Doctors and nurses working to save lives, worried about their own.
We had this nervousness when we would leave the hospital, leave the intensive care units. Are we bringing this home with us? Is this coming back with us?
That's why, after reviewing the data submitted to the FDA, Johns Hopkins critical care doctor Panagis Santos knew he would sign up to get the Pfizer vaccine as soon as he could. And yesterday, he became one of the first in Maryland to get the first of 2 doses.
Other than a bad TN line, there's no rash, no bump or anything, no aches, no fevers, no chills. Actually went and did a little bit of arm exercises this morning, feeling good. Is it still achy? Yes, a little bit, but to me, this is no different than the flu shot.
He says this vaccine is another tool, along with PPE, giving him an extra sense of security as he continues to work with the most severe COVID-19 cases.
Seeing, fathers and daughters simultaneously struggle with the virus in 2 separate rooms, talking to loved ones as we are holding the hands of a patient who's passing away, and they're witnessing that through Zoom.
As more vaccines like Moderna get ready for emergency use authorization, he recommends people reach out to their doctors with any apprehensions they might have about getting the vaccine, so they feel prepared to make the decision when the time comes.
If more companies get approved, I'm highly hopeful that maybe before even the end of the school year, the general public is receiving these vaccines.
And in the meantime, he says the current hygienic interventions, wearing masks, washing your hands, and social distancing, are critical.
The analogy I give here is, if you're on a sinking ship and you see a boat coming, you don't turn and just start putting more holes in the sinking ship. Stay afloat so you can be rescued.
It's expected that the FDA will issue an emergency use authorization for the Moderna vaccine tomorrow. For WMAR2 News, I'm Abby Isaacs.
All right.